Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined today by pandemic expert Dr. Carlos Del Rio, Executive Associate Dean of Emory University School of Medicine at Grady Health System and Professor of Medicine, Global Health, and Epidemiology. Welcome, Dr. Del Rio. As always, it's great to see you.
Happy to be with you.
So, Dr. Del Rio, we've had our weekly talks for months now, and we take questions every week from people. But you and I have discussed the prevalence of conspiracy theories related to COVID, so we thought it'd be a good idea to begin addressing some of those. So are you ready to go through 4 or 5 with me today and give me your take on them?
Sure.
Okay. First off, the reason we're doing this is because 25% of Americans believe COVID conspiracy theories. So
it's a big business. I was hearing a report in NPR saying how it's actually a multi-million-dollar industry now with ads and other things. So there is even an economic incentive to keep this going, which is very unfortunate.
Right. So here's an opportunity for us to try to combat some misinformation. We'll begin with one that I personally see very often on social media and even my neighborhood website, which is that masks are harmful and we have a graph that went around social media for people to see. Because we breathe out carbon dioxide and it's toxic. So this meme went all over social media, and it basically alleges the health side effects from wearing masks, that it does make people sicker, and that there are health impacts. Can you talk about that?
Well, there are a couple of things here. Number one, people may not know this, but surgeons operate with masks all day, and unless if you believe this, you should, next time you have a surgery, tell your surgeon, please don't wear a mask because I don't want you to fall asleep in the operating table or do something wrong as a result of this. I mean, this does not happen. This is made up science. This is not a reality. I'm going to say this straightforward and say it clearly. Masks are not natural. Masks are uncomfortable. Masks prevent us from seeing each other. Masks prevent us from talking well. Masks prevent us from, kissing our somebody. Masks prevent us from eating. I mean, the other day I had my mask on and I picked up a cup of coffee and all of a sudden I said, well, wait a second, what are you doing, right? So they're not natural, but they're necessary. And in this moment, they're necessary. And I think coming up with reasons why we shouldn't use them, I can come up with hundreds, but they're more than one reason of why we need to use them, and that is that we need to stop transmission of this virus, because we're going to get onto this later. And people are really wanting to go back to school. People are really wanting to go back to sports. People are really wanting to get back to normal. If we don't stop transmission of the virus, we're not going to get back to normal. So forget about your CO2 retention. Forget about all those conspiracy theories and just do the right thing so we can stop transmission of the virus if you truly want to go back to normal.
Another theory has been that the fear of COVID is far worse than the virus. A lot of people, of course, talk about the obvious economic impacts, the millions of Americans who've lost their jobs, but that the fear is worse than the actual virus. And then certain people with huge platforms have been speaking against it. And one of them is singer Ted Nugent, who has been very vocal about COVID. And so one of the things he wrote that went viral, and I'm going to read you just a section of it. It says, "We are not all in this together. I'm not wearing your dumb tinfoil hat anymore. I'm not going to be a prisoner of your fear. I'm no longer staying in my house or catering to you because you are scared. I'm not wearing a mask and I'm not staying 6 feet away from you anymore because I'm not afraid of you. You are not my enemy. And if I get sick, it's not because of you. It's because of me and my system, which not only have I been addressing for quite some time, but I also know how to treat if I get sick. This virus, or whatever it is already circulating. Millions of people have already encountered it. You will have to confront this thing if you haven't already. There's no way around it unless you lock yourself in your house and it somehow doesn't hop on some mail or groceries that you ordered online."
Well, there's so much wrong there that I don't even know where to start. Number one, no, you don't need to confront this virus. You can actually avoid it. Number two, it's not going to come up in a grocery to your house. It's going to come up with because you're close to somebody who's infected. And number three, if you don't want to wear a mask, it's your own decision. But please, when you go to the hospital and the hospitals are full and you cannot be taken care of, don't complain. just realize that you're part of the problem.
Is the fear worse than the virus? I know that's a bit of an esoteric thought, but is the fear of the virus worse than the actual virus?
Well, I mean, tell that to the 130,000 Americans that have died of this virus. I mean, I'm not sure they're dying, and they died of fear. They died of an infection. They died of a viral infection. So I think fear is something that we can do something about. And that's the point. I mean, we're not powerless. And I have fear about things that I cannot do anything about, but we can actually do something about this. So I can tell you, my life is not normal. I am tense. My guard is up. I'm wearing a mask. I'm wearing a face shield. I'm washing my hands. I'm being careful.
Right.
But I have to go to the hospital. I have to take care of patients. I have to see people with COVID. And fear won't help me. What helps me is using my personal protection equipment and being careful. And yes, I am concerned, but I'm not fearful. I am fearful of us as a country not doing the right thing. I am fearful of where we're headed. I am fearful of seeing my biggest fear is to see our hospitals saturated. My biggest fear is to not be able to take care of people because our ICUs are full. My biggest fear is that we're simply going to overwhelm our capacity. That is my fear.
Another theory is that COVID was created as a biological weapon in a Chinese lab. And according to Pew Research, 3 in 10 Americans believe this.
Well, again, you can believe whatever you want. There's some people that believe that the earth is flat. And, I'm not going to change that belief. I mean, I think you can believe whatever you want, but there's absolutely no scientific basis and no evidence to say that this was created in a lab. This was created by nature. And nature is actually our biggest concern. And climate change and deforestation and bringing animals in close proximity to humans, like in those wet animal markets in China, is exactly how this virus disseminates. So if you can think about what causes this virus, it's climate change, it's deforestation, it's overpopulation.
Another theory is that COVID death rates are inflated. So there's no reason that we should have to take all of these safety precautions. Are the death rates inflated?
Well, I don't know what people mean by death rates inflated. I actually think that deaths are actually undercounted because many people have died of other reasons. They may die of a pneumonia or something like that. And because they were not tested for COVID, they're not counted as COVID deaths. So I think COVID deaths are actually underreported.
The last one we'll tackle today is COVID is just another flu.
Well, I've written about this and I can tell you that it's not. The data is very, very clear. COVID is about 20 times deadlier than the flu. So yes, it's like the flu, but 20 times worse. And in particularly, if you happen to be over the age of 65, in particular, if you happen to be diabetic or have obesity or hypertension, COVID can be really very severe. And the fact is that if you are young, but you happen to be diabetic, hypertensive, or have obesity, COVID acts on you as if you were an old person. So again, this is a reminder that what we need to do is take care of ourselves, take care of our lives. Think about improving your diet, think about improving your health by exercising. But think about those things as a way to prevent future complications. And yes, if you're going to encounter COVID, hopefully you'll have less severe disease.
Thanks, Dr. Del Rio. Okay, let's get to our main questions for our Facebook Live today, and we'll begin with this. I thought the virus was not aerosolized, spread through the air. Now it is. Why these changes? Can you talk to that?
Well, this is typical epidemiological jargon. We in medicine, in public health, epidemiologists say that when something is transmitted by a large particle, by a large respiratory particle, we call that droplets. When something is transmitted by a small respiratory particle, a very tiny particle, we call that aerosols. Obviously, this is not either or. This is a spectrum. And we know that this virus is primarily transmitted by droplets, which means I'm in front of you. I produce this large respiratory droplet that flies and either hits you or falls to the ground. It could be transmitted by aerosols, but it usually is not. There's certain circumstances when it may be transmitted by aerosols. And that is, for example, when you have a lot of people. Let's see, if I'm in a room and there's one person infected and there's other 9 people there, it is, and we're social distancing and wearing a mask, is not going to be transmitted by aerosols. But if I'm in a room and there are 5 people infected, likely aerosols are being generated and I'm likely to get infected. So when I think about aerosols, I think about avoiding crowded places. I think about avoiding close proximity to people. I think about avoiding, being in a very contained environment with not a lot of air movement. And the evidence is very clear that aerosols have little to do with transmission, and that comes from hospitals. In hospitals where we have been using masks for a while and transmission has dropped significantly, we are protecting ourselves against droplets, not against aerosols. The aerosol kind of protection we use is when we're dealing directly with a COVID patient, or when we are in an aerosol generating procedure, like, for example, doing an intubation or doing something like that. But if not, we're not using aerosol protections. And by doing that, we haven't seen infections. So to me, the evidence is pretty clear that this is predominantly predominantly droplets. That doesn't mean that there isn't some transmission by aerosol. But if you're going to put them in a scale, is droplet about 90 to 95%, is aerosols about 5 to 10%.
Okay. Can air filters or air purifiers kill or reduce that virus? We know Andrew Cuomo has mandated malls in New York to use additional air filtration. But what about our homes or small businesses? Should we be investing in using air filtration systems or air purifiers?
I don't think air purifiers are going to make much of a difference. In business, in areas where there's very large air managing systems, or for example in airplanes, or for example in ships, I do think that managing your airflow and managing how your air is filtered is probably very important, and using HEPA filters and using ultraviolet light and other things have been looked at. But again, the reality is we think that has probably little to do with it. It's more importantly that, if you can, open a window, if you can, create some flow of air, have some air move.
Okay. So we're going to talk schools now, and we have several questions that have come in about that. But to do a little bit of an overview, obviously there's a lot of anxiety about this on all sides. President Trump has said that the CDC's guidelines were tough and expensive, and he discussed cutting federal funding to schools if they didn't reopen in person. Now, the CDC guidelines include desks 6 feet apart, for children to wear cloth face coverings, closing communal areas like cafeterias and playgrounds, and the installation of physical barriers like sneeze guards where necessary. What are your thoughts on reopening schools, and can it be done safely?
Well, I think the opening or not opening of schools is going to depend a lot on the amount of community transmission we have. And currently, in certain states, in certain communities, we have a lot of virus, no matter what you do to safely open schools. So if we want to open schools and our window is closing, we have to slow community transmission. We have to decrease the amount of virus in the community, because a lot of these measures are going to work. But if the community transmission is low, if the community transmission is high, no matter what we do, there's going to be transmission. So we have to slow community transmission. And that's why I implore people to start wearing masks now, to start social distancing. The efforts we do right now to decrease community transmission are going to allow us to safely opening schools in a couple of weeks. Now, there's some communities in this country right now, in New York and other places, that they're probably going to be able to open schools because community transmission is low. They've done a good job. Community transmission is low. They're going to be able to open schools. I do think that some of these recommendations from CDC are going to be hard to implement. They're going to be expensive. But having said that, I think we're a country that has the money to do this, and I think we need to put our priorities where they need to be. And I think funding schools so they can protect our children, in my mind, is a place that we need to put resources, and really speaks very poorly about our priorities as a nation if we say we cannot make it safe for our children.
Even if my children don't get COVID like adults, what is my risk as a parent of my child, as a parent of my child bringing it home to school, from school to me, or to the teachers and support staff?
Well, again, a lot of children we know will get infected but will not get sick. Now, that doesn't mean that they all don't get sick. Some will get sick, but the great majority won't. But the problem is they'll be asymptomatic, they'll bring it to the house, and they'll infect the parents, or they'll infect the grandparents, or they'll infect other people. And those are the ones, the older adults, which may get sick. It may be that you just have a mild cough or a mild, a cold, but it may be that you end up in the hospital, you end up hospitalized, you end up in the ICU. So I think that's the challenge, is that the kids going to school potentially can bring this infection home. Now, we don't know a lot about how common that is. And there's some studies that I've looked at from Australia and other places suggesting the transmission from children to adults, it's actually not that frequent because children are not very good transmitters of this virus. And it may be that actually we adults are better transmitters. And that probably has to do with the amount of virus that we have in our system. So children may actually not be very effective transmitters of this virus.
That would be reassuring. What advice do you have for school districts like Cobb County here in Georgia saying masks will be expected when kids return to school buildings, but not required?
Well, again, they're politicizing something that is technical. And politicizing what is technical, which is wearing a mask, doesn't make any sense. Masks should be required. And I would not send my kid to a school in which masks are not required.
What do you say to the people who are accusing public health experts like Dr. Fauci of being dishonest, saying his advice has changed over time about masks and other things, so he can't be trusted? How difficult is it during a pandemic to keep messaging consistent over time?
It's very hard because, in fact, we're learning things as we go along. And as you learn things, the recommendations are going to change. And I've said this over and over. I wish I would know tomorrow. I wish I would know today what I'm going to learn tomorrow, because our recommendations are going to change based on new knowledge. Having said that, I would tell you that Dr. Fauci, I would tell you that all our public health experts are giving the best possible advice based on the information they currently have.
It's scary watching what is happening in Florida and Texas with hospitals and ICUs being filled. How close are we in Georgia or Atlanta to being at capacity in our hospitals and ICUs?
We're getting very close to be there. We're not far away. We're a couple days behind Florida. We're a couple days behind Texas. So we need to take action right now. It surprises me that people are not realizing this. I mean, we are in a crisis situation. We're at a critical point in which we either dramatically stop transmission. And again, it's going to take a while for that to take effect, because if you stop transmission to zero starting today, it's still going to take 2 weeks before you start seeing a decrease in the number of cases. So my prediction is in the next week or so, our ICUs, our hospitals are going to be at capacity, and we're going to be in a crisis. And people are going to say, what happened? And I'm going to have to just say, I told you so.
What is the latest information available on the possibility of being reinfected with COVID-19 once you've had it?
I think most of the data suggests that it's highly unlikely.
Okay. Is it safe for my sister to visit and stay for a month if we both have been sheltering in other than grocery pickup, not going into the store?
I'm sorry, what was the question?
Is it safe for my sister to visit and stay for a month if we've both been sheltering in place other than going to the grocery to get food?
I think so.
Do you think putting a child in daycare at this time is a big risk?
I think it's a risk. There's no doubt about that. I mean, I think daycare will have, the kids are going to be closed. There's going to be staff there. And I think the biggest risk is going to be transmission. So I think, it's hard to quantify what big risk is, but it's going to be a risk.
Once you test positive, how long are you contagious? Will you always test positive?
Well, you're going to test positive for a long time. We don't know for how long, but for a long time for the blood test, the antibody test. But you're only contagious probably for about 10 days or so, maybe 14 days at most after you get infected. But the most of the infection, most of the transmission, most of the contagious period actually happens to be probably about 2 to 3 days before you develop symptoms, if you're going to develop symptoms. Or at the peak, it's maybe 3 or 4 days after you develop symptoms, and then it comes down very rapidly. And by the end of 10 to 14 days, you may still test positive in the swab test, in the PCR test, the molecular test, but you're no longer infectious.
I've heard from a lot of people who say they're having an incredibly difficult time getting access to testing, getting an appointment for testing. Have you been hearing the same thing?
I have, and the reason is simply it's a supply and demand issue, right? As we have a lot more cases, you have a lot more people that want to be tested, and we simply don't have the capacity to provide as many tests. So yes, again, in order to improve our test throughput, we have to decrease the number of people who are infected.
How many times can you wear a disposable mask? Are they one and done?
No, in general, I wear a disposable mask for about 5 days or so, 3 to 5 days, depending how much I use it, depending whether it gets dirty or not. But you can make your own cloth mask, and you can use a cloth mask. And here's a cloth mask, and I wear it, and I wash it every day, and I can wear it all the time. So cloth masks are also working that way. I want to emphasize that it is very important that people. I mean, I want to go over these numbers again that I've said over and over. The growth of this virus is exponential. If I'm infected today, and I don't wear a mask, and I don't practice social distancing, at the end of 5 days, there's going to be 2.5 to 3 people infected as a result of me. And at the end of 30 days, there's going to be 406 people infected as a result of me. So the growth of this infection is exponential. Me being infected today could potentially lead to 400 infections 30 days from now. And that's why it's so important to control transmission, because it's not 1 to 1 to 1 to 1. Is 1 to 2.5, and then starts growing exponentially. And if you look at the growth curve here in the state, you see that very rapid rise, that exponential rise. That is because we're not doing anything to control transmission.
Should college students opt for online classes if masks are not being required for in-class?
I would say yes.
Could you speak to Emory's plans for reopening this fall? Are you in agreement with the process or plans to date?
I mean, the plans, are complex. The plans are well thought of. At this point in time, Emory is going into what we call a compressed semester, which the fall would start somewhere, I think it's in the August, and finish before Thanksgiving, and then students don't come back. The idea is to do in person for most. There will be some classes. The big classes will be online, but the other ones are going to be in person. There's going to be a requirement for masking. There's going to be a requirement for social distancing. There's going to be a lot of testing happening. There's going to be a lot of contact tracing. The plans are good. The problem is going to be the implementation. Plans work until there's a group of students that decide to have a party, not wear a mask, and then there's a transmission. So we need to have everybody in the community buy into the plan and make a pledge to prevent infecting others.
I've heard that the tests are 50% accurate. My doctor told me she had it and she tested negative 2 times before she developed symptoms that resulted in hospitalization. That is also something I've heard. I've had a lot of people ask me which is the most accurate test because they felt that they didn't get accurate test results.
The tests are pretty good. The problem usually with the testing is not the test itself, but it's actually, number one, the sampling. If you don't get the right sample, if you don't get the sample correctly, if you just put the swab a little bit under the nose, you may miss it. Some of the tests have better sensitivity than others, but in general, the tests that we're using are actually pretty good.
I'm going to combine 2 questions because they're both school related. So many stories about camps, football training that have outbreaks. Assuming some screening testing ahead of these, can schools manage risk by testing in advance? I'll let you answer that one.
Well, testing is something that everybody thinks will help us, and it will help us, but it won't be the solution, the all end solution, because testing will tell you if I get tested today and I'm negative today. It doesn't mean that I'm going to be positive, not going to get infected tomorrow. So it's important to do potentially an entry point testing, just to be sure that, okay, do we have anybody coming in who's infected? And if that's the case, prevent that person from coming in. But again, if you're requiring masking, if you're requiring social distancing, then the testing becomes less useful. And what's important is therefore that you have testing for symptomatic individuals and that you rapidly do contact tracing.
Another school question, how safe is it for students to attend band class? Is the risk similar to singing in a choir?
I think band, especially when you have wind instruments, I'm a little concerned about with the wind instruments as opposed to the other instruments. So because you also cannot wear a mask when you're using a wind instrument. So I think that that ban may be an activity that you don't want to have.
Talking only death rates is a problem, I think. Is there another measure of impact that we should also consider?
A really important measure of impact is what we call excess mortality. And excess mortality is the number of deaths above what's normal, what you should have expected. And, so for example, let's say that here in the city of Atlanta, we should have expected, 1,000 deaths in a month. I'm just making up a number. And that's the usual that you see in a city. And all of a sudden you have a month that has 3,000 deaths. Well, you have a 2,000 excess mortality. And excess mortality becomes a good measure of impact because it's not only measuring the COVID-related deaths, but it's measuring the deaths, for example, from heart attacks and from other diseases that were not taken care of because the hospitals were saturated or people were afraid to go to the hospital. And that's one of my concerns too, as we see hospitals getting busy with COVID. Other people may decide not to go to the hospital, or they may come to the hospital with a heart attack or a stroke and not be taken care of, and therefore they can also die. So COVID impacts a lot more than just COVID, impacts other diseases.
What does the data say about the long-term effects on the body for those who've had COVID?
We don't know. I think there's a lot of, and we don't know because we haven't seen it for enough time to know. There's concerns that there may be some pulmonary impact. There's concerns that there may be, and somebody was describing the other day, some brain impact with nightmares and other things. We don't know. So, but if you want to avoid the long-term impacts, don't get infected.
If I work in a small room as a doctor for 7 hours, do you recommend that I leave the door open?
Are you there by yourself or are you there with somebody?
That's the whole question.
I mean, I think if you're in a room by yourself, you're fine. But if you're there with somebody else, you should wear a face mask. I was talking to somebody the other day and saying that, that in our clinics, we're no longer having face-to-face visits. We're having mask-to-mask visits.
Yeah.
You can still see the patients, but people have to wear a mask.
Will COVID be around like other viruses, like malaria and West Nile? Will vaccinations work if the strain mutates?
Well, I think, first of all, COVID is a virus like West Nile, but malaria is not a virus, it's a parasite. We hope that a vaccine will be effective. The type of virus we're seeing, we think a vaccine is effective. When people talk about mutations, I mean, there's some mutations in viruses that make less more aggressive, but there's some mutations that actually make viruses less aggressive. Some viruses, the initial SARS disappeared in great part because it started to be less aggressive. So mutations are not always bad. What we need to do is to control transmission.
Last couple questions. I hope this doesn't sound like a silly question. If I'm only around people who are wearing masks and I'm wearing one too, what is the chance of me still testing positive for COVID? Maybe this person means contracting COVID.
I think it's very unlikely.
What about college dormitories?
The problem is you need to make sure your mask is used correctly, right? And I think it's important that we say, this is not wearing a mask.
Right.
This is not wearing a mask. The other day I saw somebody like this wearing their mask. This is not wearing a mask. So I think if a mask is going to be effective, but you have to use it correctly. If you don't use your mask correctly, it's not going to be effective.
It's shocking how many people I see wearing masks sitting below their nose, everywhere.
And I think we need to make that very clear, that masks work, but they have to be used correctly.
This question is about dormitories. How do you manage that, all these students' living arrangements?
Well, it's complicated, and there's a lot of mathematical modeling around it. Clearly, many universities are going to single or at most double rooms, a lot of individual bathrooms. A lot of places are thinking about cohorting students. So if you're in this dorm, that group of students goes to the same classes, goes to eat at the same time. So you keep that group together. So if there's an outbreak, it's limited to that group. It doesn't go beyond that. So I think there's different models to do that.
The last question I'm going to give you is the saliva test as accurate as the nasal swab?
That's still being tested, but I think we will have probably likely in the next several weeks a saliva test that is going to be very good.
All right, I'm slipping in one more that sounds like it just came from a teacher. If I teach for 1.5 hours in a room of 20 people socially distanced with masks How high is my risk? What can I do to improve safety?
Wear a mask, and I think your risk is very low. I've done exactly what that person says. I've taught in a room with 20 people wearing masks, socially distanced, and I'm fine.
So the last thing I would love to have you talk about for us, and you've touched on this, is how we're doing in Georgia. You know, the city of Atlanta, the mayor just instituted a mask mandate. There is not one for the state of Georgia. When we see national news reporting on COVID, Georgia is now mentioned, along with Arizona, South Carolina, Florida. There are the certain.
We're not doing well in Georgia. We're doing poorly in Georgia, and it really pains me because Georgia, in particular here in Atlanta, I would say is the public health capital of the world. We have here the CDC. We have tremendous epidemiologists. We have Emory University. We have Georgia State. We have Georgia Tech. We have the Carter Center. We have CARE. So a lot of people dedicated to improving health globally. And the fact that we're not doing it locally, it really hurts me. It really pains me. It really upsets me. And I would hope that we would be doing better, but we're not. And I think we're not doing well because we haven't done the right things. We opened too soon. We opened, initially when we opened, most people stayed home. But really the turning point was Memorial Day. I think Memorial Day came, people said, I've had it. It's over. This is going away. It's time to not wear a mask. It's time to start going out. It's time to not social distance. And now, a month later, we're seeing the impact of that, right? And I think we need to, I don't want to close down again. I don't want to go into a lockdown. But I think we know what we need to do to prevent transmission. And the fact that we have not had a masking mandate, the fact that we have not had much more forceful recommendations of what to do, that we haven't closed bars, that we haven't closed nightclubs, that we haven't done the kinds of things, avoid gatherings, that we haven't, closed churches and other events, in my mind is very concerning because, again, it's almost like we said, it's fine, let's open up, let's have infections. But there's going to be pain. And there's going to be significant pain as a result of this. And I think we can do better. I hope we can do better. It's really up to us to do better.
I think it is. And one thing that I hear constantly is people saying that they're over it, that they feel like they've reached their end point. And I always think, well, we can be over it, but the virus isn't over it.
I did not live through the Second World War, but I've read a lot about the Second World War. I've read a lot about how, people in Europe, people in other places didn't say, oh, I'm over it. Let's just forget about it.
Yeah.
You were fighting a war for freedom, for independence, for the right reasons. And people did enormous sacrifices. Think about the siege of Leningrad. This was a carnage, yet people stood up. Yes, people survived it. Yes, resilience put them through. You can get over it. But the reality is still there. And if you don't confront the reality will get you. And I think we need to remember that. This virus has not gone. This virus is here. There's a lot of community transmission. There's a lot of virus out there, and we have to do better.
Dr. Del Rio, thank you. It's good to talk to you. And thank you for all of your advice and counsel, as always. And the next time that we see each other and discuss this, we'll have to see where things stand in Georgia. And my hope and prayer is that it's better than it is today.
Mine too.
Thank you. Be well. Everyone out there, take care.
Bye.
Bye.